Welcome to the weekly newsletter, 10 ways that you can ruin your skin and your health. So why have I started like that? 10 ways to ruin your skin and your health. Well, an interesting thing I listened to this week was about inversion therapy. And it's about how we're actually programmed or designed to identify threats in our environment and then get solutions, rather than looking at solutions, looking at solving things without actually considering the risks or considering the threats. So today I wanted to concentrate on 10 ways that you can ruin your skin and your health. But before I do that, to keep you watching, I just wanted to share some things from clinic with you. So we are going to be changing our CRM system again. And the reason is, as we bring in more services like private medical care, medical screening, blood tests, we need something that can be robust and resilient for you and add value. So that's why I'm investing in another CRM system. So you might find some changes. So please bear with us. Bookings may need to be altered slightly. Timings may be slightly off. And I apologize in advance. But it's all there so that we can keep serving, keep innovating for you and on your behalf. Second thing I wanted to discuss, and I'll say it again, is that I like interaction with the newsletters. Please do leave comments and likes, and please do share if you think it's useful. But I'm looking for 5 of you who are interested in investing in your health. We have a product. We have actually a range of now medical screening products. But before I put it out there, before I make sure that it's delivering, I would like 5 of you who are interested to contact me for some time. So contact me now, contact us now. You can email at information@vysana.com and just say interested in medical screening. One of the team may answer back, or I will contact you directly and get you. So 5 of you are interested. 5 of you want to test out this amazing medically and accessible range of health products that I've designed on your behalf. And I'd like 5 of you, we've got 5 spaces open. So please do email in to information@vysana.com or reply back to this newsletter. So I did promise you something more interesting than that, which is 10 ways to ruin your skin and your health. So firstly, if you want to ruin your skin and your health, don't bother using sunscreen. Why bother? Aging of the skin, 80% of aging is UV damage. So go ahead, ditch the sunscreen and get aging from there. Second way is don't exercise. Don't exercise at all. Why bother? Just 10 to 30 minutes a day, do something else, watch Netflix, scroll on TikTok, scroll on Instagram, on Facebook. Don't do any exercise. Why bother exercising? When you're on holiday and you're having to lift up those heavy suitcases, you want to put your back out. Just don't exercise. Don't invest in your health in that respect. Carry on using, if you are, physical exfoliants. I'm talking about the St. Ives scrubs, the stuff that you really think, oh, it's really good, give me a good exfoliation. Carry on using those. Those of you who watch up to this point, I will share the solutions as well, the positives from this. So please keep watching. Number 4, use sunbeds. If you're not using sunscreen, you might as well use sunbeds as well. That's definitely one way to damage your skin and your health. Definitely don't meditate. Don't practice mindset. Don't take time out for yourself. Let the stress build up, let the emotions build up. So don't practice mindset at all, or don't practice meditation. Don't take out time for yourself. Number 6, eat anything and everything processed. If it comes in a packet, definitely eat it. All those preservatives, all those sugars, all those nutrients that mean excess calories that mean nothing, definitely carry on with that. Number 7, don't invest in your health. Don't invest in your health in terms of don't get medically assessed, don't get medically screened, don't spend that little bit of time and money to make sure that your preventative measures can be brought into place. Number 8, don't have a skincare regime. Just use any products that are on the shelf. Use a bar of soap, use that to wash your face. Shampoo in the shower, use that to wash your face as well if you want to. So don't have a skincare regime. Number 9, on that note, carry on buying loads of skincare. If you're going in impulse buys, we all love Space NK and shops like that. Definitely an impulse buy, well, it looks nice and shiny. It's got the latest tagline on it. Definitely keep buying loads of different skincare. And number 10, get as little sleep as you can. That's definitely going to ruin your skin and your health. So I promised you, if you get to this point, I would reverse that now. So we've identified the threats. We've written down 10 problems or 10 things that can ruin your skin health. So let's go back through that and flip it on its head. So number 1, do use sunscreen. Do use an SPF every day. 80% of aging is sun damage. So if you're using a sunscreen, it will reduce that aging effect. It doesn't affect your vitamin D. It D levels too much, so absorption of the skin. And also, reapply every 2 hours, especially when you're on holiday, especially when it is sunny. Number 2, do exercise, but don't just focus on cardiovascular. Incorporate some weights into there. You won't get bulked up. But one of the things that someone recommended to me is that, a lot of us go on holiday. We're not used to picking up 15 or 16 kilogram suitcases, maybe even 23 kilogram suitcases, and trying to shift them onto an overhead locker or shift them onto a shelf. And that's where we injure ourselves. So why not incorporate some sort of functional weight training daily? Just 10 minutes a day will just get that muscle forming and toning, and it will be so beneficial. Use more chemical-based exfoliants. I know it sounds horrible, but using alpha hydroxy acids, using beta hydroxy acids, using glycolics and things like that as an exfoliant instead of physical exfoliants is much better for removing sun damage and problems with the skin. We mentioned sunbeds at number 4. Just don't use them at all. Use fake tan instead. There's some great fake tans out there, and some have great SPFs in there as well. Number 5, I'm losing track at the moment. So number 5, let's flip it. Do practice mindset. I think spending 10 minutes a day, even if you're in the car, even if you've woken up, you've had a bit of a rush, just 10 minutes in a day. If you go onto YouTube and put in positive affirmations or mindset, 10 minutes, something comes up, and just repeating those positive affirmations is enough to, just for example, lower your blood pressure. We've been recording blood pressures for patients in clinic, and they're saying, oh, it's high in here, but it's not high at home. Well, what is it that is about the environment that you're in? What's changing your blood pressure? And just using 10 minutes a day to practice your mindset, very, very easy. I do it every day, and it does help. It does help to bring that calmness. Number 6, make sure that you are eating, well, the ideal would be 35 different fruits, vegetables, nuts, plant-based matter throughout the week. So that can be anything from nuts, from seeds. It can be dried kind of plant matter. The point is it's much better for your gut microbiome. Incorporating things like kimchi, sauerkraut, fermented foods, and that's not foods that are in vinegar. It's actually all the ingredients should be as a food. For example, sauerkraut, cabbage, and then salt and water. That's how it's fermented. So nothing too processed. Or, sometimes we do like a little bit of a treat. I'm not saying don't do it, but equally try and incorporate less processed food into your diet. So cut out the packet stuff. Number 7, don't invest in your health. We said, well, flip that on its head. Invest in your health. That's why we're bringing medical screenings into clinic. I know it's hard to get in with your GP, and I've often spoken to a lot of you about how to manage that process, how to speak to receptionists, how to speak to GP. I'll always do that with you. I think using the NHS and using private care, kind of getting a hybrid model for investment in your health is important. And that's why we're bringing these new things into clinic. So don't forget, I need 5 of you to contact me if you're interested. Number 8, don't have a skincare regime. So have a skincare regime, and it doesn't have to be complicated. We're not talking about 5 or 6 different products. We're talking about cleanser, serum, moisturizer, sunscreen. Very simple. Even you can narrow it down to 2 products if you wanted to, especially in the summer, in terms of a cleanser and then a moisturizing sunscreen. That's what we do. I have recommended for lots of patients. So have a skincare regime, and don't have an impulse buy. We invest a lot of our time and money into Get Harley, which is our skincare partners. The point of that is a skin concierge service. So you can message them and say, this is not working for me, or this is right, I'd like more of it, or could Dr. Sunny suggest something different for me? So, virtual skincare consultations are available. I'm trying to increase those, especially 15-minute ones, so you don't have to come to clinic and we can go over your skincare with you. So don't just buy anything and everything in terms of skincare. Think about it. If you need advice, let us know. And number 10, sleep. Sleep, blessed sleep, love sleep. For many of you, for maybe even men as well who are stressed, if you're watching, that's fine. It's something to work on. Mindset is something that can help with sleep. But in perimenopause and menopause, sleep is disrupted due to hormonal change. It's something I discuss a lot. So again, try and have what we call good sleep hygiene. And in that respect, what you want to do is make sure that devices are not being used, no caffeinated drinks before bedtime, read, practice mindset before bed. And if your sleep is disturbed, then you seek advice. We obviously are. That's why we're bringing these things. So in summary, we spoke about 10 ways to ruin your skin and your health, and then we flipped it. We've identified the threats and we've got a solution. And then I mentioned we are changing CRM. So please do bear with us, and I will keep you updated, as will the team. If you have any problems, just call the landline or email us, information@vysana.com. And then lastly, if 5 of you are interested in medical screening, we want to launch it in September. We would like some feedback, and I would like 5 of you to contact me to test out the product. And so great. I hope you're having a great week. Still summer holidays. I hope you're enjoying life. If you have any questions, concerns, feedback, then just let me know, and I look forward to seeing you very soon.